Medication errors are a topic, like the MAR, that we will be studying extensively. In particular, how to prevent them from occurring. Be sure you write down the following on your worksheet. What actions are considered a medication error? What do you do if a medication error occurs or if you discover a medication error? Who do you need to call if there is a medication error? What documentation is required and when is it due? A medication error is wrong medication, administering or supervising the medication for any symptom, illness, or reason other than as prescribed, administering or supervising medication with no current order. Wrong dose, administering or supervising an incorrect strength or amount, administering or supervising more than one dose of the same medication in a scheduled time period. Wrong client, administering or supervising medication to a client, a medication that is prescribed or ordered for someone else. Wrong route, administering or supervising a medication by a route other than the route in the prescription or order. Wrong time, failure to administer or supervise a medication within 60 minutes before or after the prescribed dosage time. Failure to document, failure to immediately and accurately document the administration or supervision of a medication on the MAR. Expired or improperly labeled, administration or supervision of a medication which has expired or is improperly labeled. Failure to count, failure to conduct an accurate medication count for controlled medications. Failure to give the medication. Client refuses, MAP or licensed provider did not administer the medication, medication was not available, new order not initiated within 24 hours, refill not ordered timely, insurance issue, pharmacy issue, family error, other reason not given, MAP not validated. The MAP was not validated as required by 65G-7.004. What to do if there is a medication error? Immediately following the discovery of an error, notify the supervisor. For a wrong dose, wrong medication, or wrong client, immediately notify the client's healthcare practitioner. Watch the client closely for at least 60 minutes or as long as the healthcare practitioner directs. Immediately report any changes observed in the client's condition to the healthcare practitioner. Call 911 if the client shows any signs of respiratory difficulty or other potentially life-threatening symptoms. The prescribing healthcare practitioner must be notified for the following medication errors: the wrong medication, the wrong dose, the wrong client, the wrong route. If there is no licensed healthcare provider available to take the practitioner's orders over the phone, request a practitioner prepare and electronically transmit via fax or secure email a medication directive addressing the error to the client's home, facility, or pharmacy. Be sure to document the practitioner's response or lack of response. It is extremely important that you fully document all observations and contacts on the medication error report form. We will be discussing the form and I will teach you how to complete it in Module 2. It is my hope, however, that you will not need that skill often, if at all. Please be sure to place a copy of the medication error report in the client's file. You may also use an electronic report form if it collects all of the information required and collected on the APD form. Please remember that medication error reporting system is not meant to be punitive most of the time. It is a way to discover problems in the system that led to the medication errors and to come up with ways to prevent them in the future. When we know why they happen, we can prevent errors. Self-reporting a discovered error along with a plan to prevent it in the future is much better than hoping that the medical case managers, monitors, or clearant doesn't find it. The consequences for not reporting and leaving it for someone else to discover are almost always more severe than those for self-discovery and reporting. The medication error report must be submitted to the regional APD office within 24 hours of discovering the error. If you're working in a facility, the facility administration must also receive a copy within 24 hours. Again, a copy of the report needs to be filed in the client's file and with the MAR for review. If you have any questions about the policy and procedures for reporting medication errors for the provider you're working for, be sure to ask your supervisor. What to do if the medication error is a discrepancy in the controlled medication count. Be sure to report the discrepancy within 24 hours following the discovery of the error to the regional office and the MAP or licensed provider supervisor if applicable. The MCM will determine if the error justifies a corrective action, and the provider will be notified in writing of the necessary corrective action plan, including a reasonable time frame for completion. Failure to complete or comply with a corrective action plan. If and when the medical case manager decides that a medication error justifies a corrective action plan, you or your supervisor will be notified in writing by the regional office. The corrective action plan will let you know what needs to be done and will give you a specific and reasonable time frame to complete the plan. This is not something you can ignore or blow off. It is extremely important that you complete and comply with the plan. If you fail to do so, APD may take action against you and or your employer. Possible actions include, but are not limited to, action against your validation, preventing you from providing medication administration services, action against the provider's residential facility license, and action against the provider's Medicaid waiver services agreement. You called the pharmacy concerning Mary's 7 a.m. Keppra, and they said the delivery person couldn't get it to you until later this afternoon. The nurse discovered the refill was missing from the delivery and called the pharmacy yesterday. You know that Mary will have a breakthrough seizure if you wait that long to give her the medication. You notice that David has a prescription for the same strength of Keppra, and you can replace the pill you took by taking one of Mary's pills from the bottle and putting it in David's bottle after the pharmacy delivers her medication. You decide to give her David's pill so she won't have a seizure. Is this a medication error? Perfect. This is an error on many levels. First, it is a medication error because you gave a medication to the wrong person. It was prescribed for David. Second, the law only allows a pharmacist to take medication from one bottle and place it in another. This is considered repackaging. You are not permitted to even take the last remaining pills and put them in the person's refill. The pills must stay in the bottle they were dispensed in from the pharmacy. I'm sorry, your answer is incorrect. This is an error on many levels. First, it's a medication error because you gave a medication to the wrong person. It was prescribed for David. Second, the law only allows a pharmacist to take medication from one bottle and place it in another. This is considered repackaging. You are not permitted to even take the last remaining pills and put them in the person's refill. The pills must stay in the bottles they were dispensed in from the pharmacy. Your relief is running late and gets to work at 5:45 p.m. You have to pick up your child at daycare by 6 p.m. or they will charge you $2 per minute for every minute after 6 p.m. The daycare is 20 minutes away. Your coworker suggests you count in the morning when you return since she doesn't give any controlled medication. You agree and rush out to pick up your child. Is this a medication error? Perfect. A controlled medication count must be completed whenever there is a shift change or at least every 24 hours. Failure to complete the count is a medication error. I'm sorry, your answer is incorrect. A controlled medication count must be completed whenever there is a shift change or at least every 24 hours. Failure to complete the count is a medication error.